Carol this question. So, a very broad question, really. What are the effects of mental health problems on those affected, their families and carers? And what can we do to support them? Okay.
Okay, am I on?
Yeah.
I think one of the biggest challenges that we've got in mental health is this investment in the medical model. We still are pathologising people with mental illness. We're still seeing it as their fault or a failure. And we then look at the individual rather than the context in which that individual is living. So we're not looking at a family context. How it impacts on the family is very profound. If you've got someone in your family that has a mental health problem, it has an impact on the relationships, on the dynamics of the relationships, and it impacts on individuals. We've got carers who are trying to manage quite often on their own. We've got children who may not be attaining at school, may not be going to school. There's lots of impacts of mental health that I think people aren't taking into account. And I think the reason they don't take it into account is because the individual patient is seen as in isolation. What we're not doing is seeing that patient in a family context, in a social context. And I think that's something I'm hoping and I'm sure the new model will address. But I think it's a big challenge for us. There's a real disconnect between the notion of mental well-being and mental ill health. It should be part of a continuum. It should be something that we all know can affect all of us, but we don't see it like that. And I think for families, they're often left holding the issue with mental health professionals coming in and dealing very specifically with the symptoms, but not looking at the social context. And I think it's particularly hard for carers. I mean, carers have spoken a lot to us about how they hold quite often the anxiety of the patient, whoever that might be. Now, in terms of their expertise, it's never really recognised. When medical professionals get involved, they don't see the carers as having any real impact or knowledge base about what's going on. And again, I'm hoping the new model will change that, because the new model that James has talked about incorporates this whole thing about medical and social. We're not just looking at the patient, we're looking at the whole family. What's going on in that family? What's happening to everybody in that family? And how can we help all of them? I wanted to say a little bit about women because, again, as patients, if you look at the role of women in society, they're much more likely to have experienced sexual abuse as a child, they're much more likely to have experienced domestic abuse, they're much more likely to have experienced rape or sexual assault. All of these things will impact dramatically on their mental health. But we've got a medical model that doesn't actually ask those questions. We haven't got an inquiry, and people aren't asking what's underpinning this mental health. I think Marvin's spoken a lot about discrimination in race. We don't really look at the social context in which the mental ill health is happening. And I think the new model is going to address that because of the reach we've got. I think also, until we address this kind of condemning of someone with a mental health problem, seeing them as a failure, we're never really going to make any difference to the prevention agenda. People won't come forward if they think that they may have their children taken away. They won't come forward if they think they're a dysfunctional family. They say that, so we've got to really challenge the whole notion of mental health. And I think we have to do it in a coordinated way, in a partnership way. But we have a huge disconnect between lots of people talking about mental well-being, and people, I have to say, particularly maybe from some social classes, not others. And then we've got this huge divide, and then we've got mental ill health. Until we connect those dots, until we see mental health is everybody's business, it can happen to any of us, we are not really going to take this agenda forward.
Can I just share, Tara?
Yes.
I think picking up on James and certainly what Carol said is so powerful. So as a child, one of the numbers that floats around with the Department of Health a few years ago with public health was around 50% of lifetime mental health problems starting before the age of 14, and 50% of those being preventable. So when we think about the cost and the cost of failing to intervene in a timely way, the failures there are to support our children and young people, and that's not just with direct services. I think, like Carol said, it's about the conditions. So, I mean, I grew up, I think, I don't know about my own mental health, but I grew up with my mum. We lived in Lawrence Weston for a little while. My mum was a single white woman with a brown baby in the 1970s. Yeah, we were poor. We lived in a refuge for a year because of her depression and abuse that was going on in her home. Then we moved to Lawrence Weston, which was an interesting experience, being in the 70s. And I saw all these conditions playing themselves out in my family's life, yeah? I remember being mistreated by the council house, and from a very young age, experiencing that stress of thinking these people don't respect my mum, and then becoming aware of my own racial identity and how that didn't fit with Bristol, being chased down. All this took up emotional space in me, in my life. And I've described to people just growing up as a young person just with this permanent feeling of having a dark shadow on my shoulders, weighing me down. And I see it going on again. And what I think the exciting opportunity there is for us, and the sea change in our thinking, is to think that this is, when we think about health, that we don't just think about the services as we're talking about. I think what we've got to look at are health services becoming leaders of place. So in the NHS, they're doing a big review of what it means to lead in the National Health Service. One thing is just about being emotionally intelligent so that you don't get senior staff mistreating their junior staff. We're doing all that sort of stuff. But the next thing is, how do we get a health service that has the opportunity to have something to say about housing, about wages, about what happens in the education system? Because unless we get that type of intellectual and expertise investment upstream in people's lives, it's going to turn up as a cost downstream, not just for the health service, but as we've heard, it's going to turn up as school interventions. It's going to turn up as a criminal justice system. And it would be a tragedy in the lives of the individuals, but actually it's a collective health service cost burden that we all know we cannot afford. And I'd love to see that kind of transformation taking place in the sheer scale of the vision of what we have. What is the role of the NHS today? It's not just provision of services. It's about genuine national policy leadership.
Thank you, Guy.
Yeah, just picking up on Marvin's point, I think mental health is still the Cinderella when we look at strategic planning in local government and in central government. And that needs to change. It needs to be mentioned as important as the environment is. People's mental health should be as up on the agenda in the same way that we talk about climate change. It is so significant, yet at the moment it's really a Cinderella. And that's what we have to do together in partnership, change that agenda.